The coronavirus pandemic struck developing economies at a time when they had already been struggling with unsustainable debt burdens for many years. Due to deteriorating fiscal positions and heightened public debt vulnerabilities, Sub-Saharan African governments are struggling to find room to deploy fiscal policy to address the COVID-19 crisis. Research reports that developing countries now face a wall of debt service repayments throughout the 2020s. Zambia, amongst other developing economies, is not exempted. As the financial turmoil from the global crisis continues, the country has experienced sharp currency devaluations, making debt servicing more strenuous. Join various civil society organizations from Zambia as they give their voices on the impacts of COVID-19 on the debt sustainability in Africa and Zambia in particular.
My name is Ngwase Mwale. I'm the Executive Director for the Non-Governmental Gender Organizations Coordinating Council, NGOCC in short. NGOCC is a network umbrella organization for NGOs and community-based organizations that are addressing gender and development. We particularly focus on promoting women's empowerment for gender equity and equality. And our presence is in all the 10 provinces of Zambia, and we are currently covering 62 districts. Okay, first and foremost, the COVID-19 pandemic took the whole world by storm, where it was clearly evident that the world was not prepared for this pandemic. And of course, it brought about a lot of socio-economic implications, for the populations of the world, and Zambia in particular was not spared with regards to its impact.
Eugene Kamilika, I'm the director of Caritas Zambia. Caritas Zambia is a department of the Catholic Secretariat, or under the Zambia Conference of Catholic Bishops. Well, even before the COVID-19 came into effect, we noticed as Caritas Zambia that the country was struggling to sustain the debt levels that they have, at the same time respond to socio-economic programs that the country was supposed to take. In other words, the amount of money Zambia was paying on a monthly or quarterly basis to its lenders was, stripping the amount of money that they actually need for development. That was before coronavirus hit the scene. Now, with the coronavirus pressurizing on more funding to be taken to health, it meant that literally Zambia didn't have any extra funds available to respond to the magnitude of the impact of the COVID, and what was needed to prepare hospitals, to prepare staff, what we now refer to as the frontliners in the fight against COVID. So to make sure that they have all the protective equipment that they need, that there's all the centers that are needed to isolate people and all that. So that cost quite a lot of money, and to do sensitization, follow-ups and all that. So the question was, if we have so much debt, where is the money going to come from?
Oliver Sasa is my name. I'm currently the CEO and the proprietor of Premier Consult Limited, which is a consulting firm that undertakes consulting work for within Zambia and the Southern African region. Well, firstly, when you talk about debt or debt sustainability, it speaks to the extent to which a country is able to service what it has committed itself by way of debt commitment when it's forced due. It's expected that the magnitude of what you borrow is aligned to your capacity to service it when it's forced due. In the Zambian case, the challenge has been that looking at the debt sustainability analysis that has been commissioned by outside bodies, including by the Zambian government, indicating clearly that we are slowly gravitating towards debt default, especially on the external side. Essentially what that means is that when, especially the Eurobond bullet payment that is due in 2022, when it will fall due, looking at the coffers and how much we have in our treasury, and anticipated flows of resources into the treasury, we are not likely to be able to pay. So that's why now there is talk about restructuring and renegotiating some of the bonds, suspension some of the bonds because of that challenge.
I'm Laura Mead. I work for the Alliance for Community Action, and the Alliance for Community Action is an NGO. We work predominantly in public resource accountability monitoring. So we ask questions about how public money is spent and managed, and especially try to empower citizens to ask questions themselves that are usually asked by civil society. It was broken. And so I think the biggest problem we have in Zambia is that a good amount of our resources that could have been directed towards the health sector have either disappeared into corruption, but also a significant amount of money is directed to flying out the connected, the power holders, the minister, the president, to accessing their health care outside the country. So we've had a very unequal healthcare situation. And so if you're a minister, if you're a president, you're a child of the president, you're very sure that you've got world-class healthcare, because if you're unwell, if you've got a toothache, you fly out of the country. While here in Zambia, we've already had healthcare difficulties in that we have Medicare, you have shortages of health, of meds, you have shortages of equipment, you have very poor ratio between healthcare worker and the citizen. So I think we're already in a bad state.
Our health system, if you look at the effects of COVID, to a large degree, is multifaceted. The first, I think most visible one, is the health systems, the extent to which it begins to not only eat into the health budget, but whether or not that health budget is sufficient to meet the expectations of the population, of the government in terms of the planned growth within that sector.
Basically, one of the things that we as civil society have been observing with our health system prior to the COVID-19 pandemic was that the inadequacy of resource allocation to the health sector has been on the lower side, way below the Abuja declaration, which demands for 15% budgetary allocation to the health sector. I think Zambia has been averaging around between 7 and 9%. So of course we pre-COVID-19, there were quite a number of services that were not being provided to their fullest capacity. For example, the medical equipment as well as medical supplies in a number of our health centers have been a challenge, including the availability of essential medicines. That was the order of the day. A number of communities, especially in the rural areas, were still having a challenge to even access the health facilities because of the distances, especially when you look at the reproductive health and rights services for women and girls out there in the rural areas. So you find that already pre-COVID-19, there are quite a number of challenges that were impacting on the health sector.
My name is Father Alex Muyebe. I'm the Executive Director of JCTR. And as some people may not know that JCTR is a faith-based organization that works on issues of social justice and promotion of issues to do with social justice, economy, and advocacy, advocating for issues to do with social justice in Zambia. The civil society has had to join hands with the government in responding to the pandemic, and some of the activities which the civil society has been doing in Zambia has been to step in to carry out sensitization of the communities on the need to contain the spread of COVID-19.
The other thing that they did was to protect their own workers from being affected. And so you find some of the civil society had either partial lockdown, others, or their workers were working from home, or others were like Caritas, some of our workers working from home, but those that the key people, the head of various units, partially working. So that has been some of the responses that we've been doing. Apart from doing sensitization in the community and all that, but also took measures to make sure that their own workers are not infected with COVID-19.
First and foremost, we realized that COVID-19 took the country and the world, by surprise in terms of preparedness. So we stepped on board as civil society to also ensure that we participated in the sensitization on the implications of COVID-19, how communities can actually prevent themselves, from contracting the COVID disease, how communities can also help by being champions of ensuring that information was disseminated out there. So what we did is we were able to partner with the Ministry of Health. We reproduced the COVID-19 information brochures and posters, to be able to circulate and distribute them, to the communities as well as to the various areas where our members are. Any financial assistance that will be provided to a country would ensure that we beef up, for example, the COVID-19 financial package that the Minister of Finance, for example, in Zambia announced. So any financial assistance that will be given should also consider the plight of the woman out there in the marketplace, should also consider the plight of the woman out there who is selling tomatoes in their compounds just to be able to feed their children. Another aspect of the financial assistance that will be given is something that will be directed towards enhancing technology system or the technological advancement at national level. Because, for example, the schools now are moving towards e-learning. So, and we find that our technology infrastructure in Zambia, especially amongst our schools, was not quite so developed. So that kind of financial assistance is really something that would be able to be channeled towards ensuring that our education system has got technology infrastructure.
Well, how it will be used is very difficult to say. We would hope that it will especially support those at the lowest level, because we have a country in which a huge majority of the citizens work in the informal sector. They've been unable to work. We've had companies closed down. We've had sectors closed down. Those charity sectors closed down. We are hoping that these will be supported. Whether they will be supported again is an accountability question. We're not very sure what government is going to do. So far, I think the hunger levels have gone through the roof, and we do not see the kind of support we as the ACA would have wanted for the most vulnerable among us.
Yeah, like I said before, that like for example, Zambia, and even many other countries, on their own, they do not have enough resources to be able to fight the pandemic. It's an emergency. Nobody knew that there was going to be such an emergency, and that is so demanding, especially on the health facilities and the provision of health services to those that are affected and into the general population. And because of the measures also that have been taken by various governments, such as the stay-at-home, lockdowns, and so on. So, nature of business also disrupted. Close of bars, close of trading places has had an effect also on business. So no one planned for such. So the question that arises, how do you make sure that the person whose bar, let me just pick one single example, whose bar has been closed and is not making any more money, how does that person now pay the workers that were working? And how does he sustain such services as ESCO supply, water supply, and so on and so forth? So money that has been given by other business people and the government, if it works prudently, those are some of the measures that they can, the money that they can use to what is now being referred to as stimulus package. How do they help business to start off all again? Yeah, so that's the kind of money that they can be able to use. If it is used prudently, then they can kickstart the economy after it has slowed down or halted completely.
Austerity. You see, the debt burden in Zambia is one of sort of reckless borrowing. So the borrowing needs to stop. it is imprudent use of debt, as well as just general imprudent use of resources generally. So if the first thing we need to do as a country is cut down on unnecessary expenditure, support those, like I say, the underprivileged, so the social sector that supports the poorest among us, and then the biggest cut needs to be done at the top.
I think the debt burden for Zambia is something that is of great concern, because it leaves no one behind in terms of its impact. We know that the increased debt burden for Zambia has had implications on basic social services, because we've seen that not much resources are being channeled towards the social sector, for example, of health, education, agriculture, and the like. So the issue of the need to address the debt burden is actually very, very important, and like as a matter of agency for the country. First and foremost, I think some of the propositions that our government need to seriously look at is to be able to convene broad-based intervals of economies, of development actors, of financial experts in terms of how Zambia can begin to negotiate for debt restructuring.
I'm Felix Nkulukusa. I am basically a consultant, and I worked for the government for over 15 years in the Ministry of Finance. Rose from being an economist to being the permanent secretary in charge of economic management and finance in the Ministry of Finance. My experience from working in the Ministry of Finance with regard to debt and the relationship, or the international relationship with this organization, is that we need to have an economic program. And that economic program needs to show that we are sustainable, or we are moving towards sustainability. The challenge that is there now is that we don't seem to have an economic program, and therefore there is no indication that we are going towards debt sustainability, or we are implementing programs that can give us debt sustainability.
Well, we are all aware that the government of Zambia, through the Reserve Bank of Zambia, put in place what is called a 10 billion kwacha stimulus package, which is a mid-term refinancing package, which is targeted at the commercial bank, but also non-financial institutions, which then could use that money for refinancing or restructuring, or providing loan facilities to various business entities, including even households. That in itself is a very good initiative. It's a progressive approach because it repositions the country to be ready for, to record some economic growth even post-COVID era.
Okay, first and foremost, Zambia's homegrown economic and financial stimulus package, which was announced by the Minister of Finance, we thought that was a good step in the right direction. But from our standpoint as NGOCC, a civil society organization, there hasn't been any broad-based engagement on what sort of stimulus package would be realistic and would be revolutionary, to the various businesses and institutions, for them to be able to, to come out of this COVID-19 pandemic and be able to begin to do their business normally.
Well, as far as we are concerned, it's not very clear. Of course, there's 10 billion that have been set aside, but the Bank of Zambia's guidelines on that has not been very clear to common men and women out there. Let's look at a person who is actually welding gates or manufacturing simple little things at a shop. How does he access that 10 billion? Through the bank. The bank's interest rates are high, they cannot be able to survive. So we need to tailor-made so that it not only benefits those who are already well off, but benefits those who are literally struggling, trying to make ends meet. That way it would be, that stimulus package for us, the country, can be better utilized. But at the moment, as far as the information filters, we hear that very few people have actually benefited from that 10 million. Yeah.
We've been told, figures have been thrown up. We've been told the 10 billion kwacha stimulus package, which comes with the kind of conditionalities that seem to be intended to keep out the ones that need it. So you're supposed to have a collateral. Most poor people don't have collateral. Their businesses are hand to mouth. So a lot of pronouncements have been made, but they don't look as if they'll be accessed by the people who actually need it.
Two ways. One is civil society should be able to come up with evidence-based research that they will be able to use to present to the government with workable solutions. Two is that civil society should partner with the government in advocating for an economic program. The first thing we needed to do is have an economic program. Anyone who we owe money to will not forgive us because we have talked or we have pleaded enough. But if we demonstrate that we are serious, we are capable of paying this debt, and this is the program under which we think we will be capable of paying this debt, and if that program works out, then they will be able to do that.
By civil society, we can broaden the concept of civil society to mean non-state actors, which include the private sector. The response has been generally positive. On the civil society part, there are a number of NGOs, including CAS, local and international NGOs, that are focusing on messaging, to take the message to where it's required, with a view to sensitizing the population of the dangers and what should be done to stay safe.
There's nothing that can beat the need for collective voice, where civil society needs to work as a team. We need to recognize that despite the civil space being diverse and different civil society organizations looking at different mandates, what we see is that we still are yet to bring forth a more coordinated approach on looking at debt from different perspectives. Where we can have civil society that are addressing agriculture, civil society that are addressing governance, civil society that are addressing environmental issues, civil society like ourselves that are addressing gender. We need to come up with a coordinated kind of grouping where we can do constant analysis of what the debt burden is doing on the economic situation of Zambia. We also need to look at how else are other countries also dealing with the issues.
Well, firstly, of course, this goes beyond for the average African country in terms of debt cancellation. The G20, and they recall the IMF and the World Bank are the ones that are called upon bilaterals to consider debt payment suspension and possible cancellation if it's possible. But essentially, they were focusing on the suspension of demands for payment. For me, this is very important. And we expect a positive response from these countries because at the end of the day, a number of African countries, including Zambia, presently, are choked by debt repayments. I think what's important here is that the effects, especially with COVID-19, is that action has to be taken. And many of these countries are stressed. If you combine salaries of civil servants in Zambia and the debt repayments, they consume close to 90% last year. It's about 86% of the entire national budget resources generated internally. You are really talking about them having overshadowed literally everything that government is supposed to be doing. In the last 4 years, China has been the major source of debt to Zambia, getting into infrastructure, into a number of things. So a cancellation or a debt suspension by China of debt owed to it by Zambia would bring significant relief.
It might work for other countries that will be able to make use of the period that the payment has been suspended. But for others, it just suspends the pain. Even if there is this window of suspension, what they have on their own cannot generate enough money to be able to put together and when the time comes to pay the debt.
I tell you that will go a long way in assisting African countries because it will give them the fiscal space to use the current resources they have instead of servicing the debt to be able to augment it and fight the COVID. And it will also help to basically jumpstart the economy in some of the economies, because we have seen there are a lot of measures that these countries are putting in. Some countries are easing their monetary policy. This means that if they ease the monetary policy, there will be some impact on inflation. Some countries are lowering their reserve ratios. Again, it means that there will be those challenges. So with this support from the G20, the AFDB and the World Bank and the IMF initiative, I am very sure that it is going to give a lot of relief, and I wish Zambia would be able to access part of this relief.
Haphazardly, and there was even we've heard of South Africa that seems to have a strong, well thought out process. I think the problem with most of the African response is, if I take the example of Zambia, take the example of Tanzania, for example, it seems to go against expert advice. So in Zambia, we claim that we've had some kind of shutdown. We haven't. If you go to our markets, if you go to our town center, you have crowds and crowds of people. The reason for that, again, is the question you asked before. Our economy pre-COVID was already on its knees. So government has been unable to close down the economy like it should, probably, because it does not have the resources to support its people. So our pre-COVID budgetary choices, our pre-COVID public resource management choices have made our response very weak. And I think in the same way for Tanzania.
The response has been mixed. There are countries that have been a little bit more positive, especially in terms of giving more organized responses and sequenced responses. And I think number one really in the region, in Africa, Sub-Saharan Africa, is South Africa. I think now they are at level 3 or level 2 towards opening up in a more truncated but organized manner and with criteria of when to move at what level and with what speed, clearly determined. You are seeing a more organized state. Kenya is another one that has actually demonstrated a more resilient approach to managing it in a more organized manner. Zambia, we've tried as well. There definitely are areas of improvement where we need to see, especially at the multi-sectoral levels, where different ministries are not, to some extent, pulling in the same direction.
I'm not aware of any concerted efforts at the level of the AU that has mobilized all African countries to be able to respond jointly as African countries to respond. But I think it has been left to individual countries to be able to respond. But what would be good is an effort to galvanize the efforts that African countries are making to respond to COVID.
Again, when you look at the region, we don't have similar stimulus package. For instance, South Africa, Mauritius, Congo DR have got packages including easing the monetary policy. Others don't have that package. Botswana, for instance, and Mozambique have gone further to even lowering their reserve requirements. Zambia hasn't done that, or other countries haven't done that. Several other countries in different amounts and or different quantums have come up with macroeconomic measures, fiscal policy measures. Again, each one of these are doing that according to their ability. Again, if we were to attack it from a regional perspective, and probably this is how the thinking should be going forward. If we had the COMESA perspective, we had the SADC perspective, we had the AU perspective, probably within the different countries and the capacities, then there would have been top-ups from the regional funds that would have allowed each one of us to be able to implement these measures fully and be able to mitigate the impact that the COVID would have on the respective economies.
Yeah, well, I mean, it's more or less in terms of homegrown economic stimulus packages are important, and because it's really through that governments can begin to harness their own resources to be able to target. But let me say something that I'm not seeing much, not only in Zambia but elsewhere. That when you talk about homegrown economic packages, we always look at the treasuries, national treasuries. My view is that there's so much money floating around, even internally, without before we pick our balls and begging outside. There's so much money, so many resources from the private sector, from individual benefaction. And when I say resources, I'm not only talking about money. Much of fact, the COVID-19 challenges is really the thought process. What should we do more efficiently? Do more with less money. You need knowledge brokers that will help you. And these knowledge brokers are out there in the market, in universities, in foundations, in think tanks, in private individuals that have competencies, special skills mix. You need actually to do that. You need to harness that, especially in countries like Zambia, where there are limited treasury resources because the economy hasn't been doing well lately.
Well, the African leaders, maybe let's take one group specifically, that of African finance ministers. I'm aware that African finance ministers are working together with the UN Economic Desk for Africa. Back in March, they put out a voice calling for debt suspension. And so that has resulted in some debt measures that have been taken by, take for instance, G20 and others. If you speak of presidents, each country has been working on its own to protect their citizens within their boundaries. But I'm yet to see where the African leaders are coming together, working as a bloc to address this issue of the COVID-19 pandemic. Just like the African ministers of finance work together, of course, with a force and impetus from outside the UN, are getting them together to put out a single voice. So we don't want to see also a single voice coming from the African leaders. Thank you.
Yes and no. Yes, the voice has been heard. The question is, can we be given the relief again? We are just coming from the hip. Each one of us African countries had different challenges. The World Economy said, let's sit down and try to see how best we can help these countries. After those challenges, we went back. And remember, there was a rush to the bottom. And the rush to the bottom was who now gives the money. We had the fiscal space to borrow. Most of us Africans, we then went to the private lenders, and most of us went to the East, we went to China, and most of this debt is not commercial. It's not multilateral, it is commercial debt. The question is, if we ask for HIPI, do we think that these commercial lenders will forgive us the debt?
They've asked for debt relief, they've asked, you hear talking about Zambia restructuring the debt. The problem what I would say to ministers is that the answer is not only in COVID or in the COVID response, it is in changing the way we use our resources. So COVID is one crisis, we'll have another crisis. It feels a little bit as though our finance ministers have been given an escape route from the bad decisions they made before. So the bigger question I would ask if I was a donor is, if you are given this debt relief, what are you going to do with it, given that you were given debt relief in the year 2000 and right now you are 3 times more indebted than you were just yesterday?
Let's start from the regional level. I think we haven't yet had any discussions around the debt at the regional level. I only know that Kenya, I think Nigeria and Ghana have had some contact with the regional effort at cancelling debt. What makes the regional strength of civil society is the country strength of civil society to begin to work around debt. So I believe that if in Zambia we have a very strong network of civil society organizations that is researching on debt, giving alternative what should happen to debt, and maybe even campaign to have debt cancelled, it will lead to Kenya's strength, Nigeria's strength, South Africa and others, and all put together, then we have an African huge voice from civil society organizations that can be linked now to the international efforts.
At regional level, we must be able to understand and appreciate why this debt, how it came, why it came, can it be resolved. And when we are going to engage and help, we should be engaging with the solution. If our call is just to say, let the people that have given us money forgive us, we are forgiven hippie. If we are forgiven today, we may create a tendency where, again, African leaders will go, or African governments will go and borrow, knowing that since we have been forgiven twice, we'll obviously be forgiven the third time. So we don't need to create a precedent.
Firstly, debt has to be separated, in my view. I don't know how the question comes out, but debt should not be seen as an offshoot of COVID. Sometimes we try to blame COVID for everything. In the Zambian case, for example, the debt challenge, the debt madness, the problems of managing debt sustainability came well before COVID-19. And therefore, what we need to do, even outside the parameters of the challenges brought about by COVID-19, we need to put in place systems that manage debt acquisition, debt management, and the debt application. Those three are in the right footing.
I think COVID in itself has both positives and negatives. The positives in that everybody has woken up. It's working as an awakening kind of situation, and that in that awakening, a lot of innovation is being considered. The negative issue is, of course, where we have to deal with the short-term implications of high unemployment levels, the health pandemic and the implications that is having on ordinary people, the need to, we've had to divert resources from other sectors to be able to adequately respond. And I'm giving an example of Zambia.
The key challenge that we have is the challenge of transparency, availability of information, and accountability. For me, that is the key challenge. If that information is there, if there is transparency in the debt contraction, if there is the information is available, if there is stakeholder engagement, we would not have these challenges.
Again, I would say it's in the citizenry of Africa and Zambia especially. Citizens need to understand how bad choices always have a price. The reason why we've been unable to respond to COVID as expected by experts, for example, is because before COVID, we were so indebted and we don't even know where that debt was. So the decisions you make today, the decisions you make on any given day are brought to bear when a crisis comes in. So what citizens need to understand, what governments need to understand is that we need to make budgetary choices that are prudent, that have got foresight for them. Right now we are crying out for help, but it is help that we would not have needed had we managed our natural resources better and we managed our budgets better. So this has shown how badly we manage our own countries.